A Russian doctor who shook hands with Russia's President Vladimir Putin just last week has now tested positive for COVID-19. Kremlin has said that Putin is being regularly tested and protected around the clock. Last week, Putin visited Moscow's main coronavirus hospital, where the doctor, Denis Protsenko, gave him a tour of the premises. Putin had worn a hazmat suit and a respirator while checking in on the patients. But after the tour, both the men interacted without any protective gear. Putin was even seen shaking hands with the doctor. The doctor is under self-isolation in his office for the time being. This is not the first time Putin could have come into contact with a coronavirus positive patient. Last week, officials detected a COVID-19 case in Putin's administration. They claimed the person in question had not come into contact with Putin. So far, Russia has reported over 2,300 confirmed cases of COVID-19 and 17 deaths. Russian lawmakers have granted the government powers to declare a national emergency. The country is not yet under a complete lockdown. To stop the further spread of the virus, Russia has enforced strict social distancing laws. They include a 7-year jail term and hefty fines for breach of lockdown restrictions. Since the month of February, Russia has taken several steps to tackle COVID-19, starting by shutting off borders with China and isolating early suspected cases. Last week, Putin called for a non-working week. The messaging was not strong enough. It sent several Russians towards the southern coast for a summer holiday instead of self-isolation. They thought life would return to normalcy after the week-long break. On Sunday, Moscow, the epicenter of the outbreak in Russia, has announced a lockdown with immediate effect. Only essential stores will remain open. Restaurants and cafes have been shut. Moscow has also been using CCTV cameras and facial recognition to crack down on people who are violating the lockdown rules. Despite all these restrictions, Russia has recorded its highest single-day rise in the number of cases, with over 500 fresh cases being reported. So far, only Moscow and St. Petersburg were under a lockdown. Now, nearly 40 out of the country's 85 regions have moved to introduce a lockdown. But experts and even ordinary Russians have voiced skepticism over the accuracy of official figures. There are doubts over the country's testing rate as well. And now we have our correspondent Julia Chapman joining us live from Moscow with a ground report. Julia, thank you so much for joining us live on this broadcast. Talk to us, the doctor who gave Putin a tour of the coronavirus treatment premises has now tested positive. What are you hearing from Kremlin at this stage?
Well, the Kremlin says that President Putin has been tested regularly and so far has not shown any signs of having the coronavirus, and they will continue to monitor him very closely after he did come into very close contact with that lead doctor who is heading up Russia's coronavirus response at Kommunarka, the main hospital just outside of Moscow that is treating most of the severe cases of coronavirus here in Russia. But of course, it is a matter for concern. The two met extensively last week. A week ago, President Putin toured that hospital and the two shook hands and spent a lot of time together. And only later did a hazmat suit get put on by the president himself as he went around that hospital. But there was prolonged exposure to that lead doctor who is now tested positive for coronavirus. So there are certainly concerns that President Putin could have contracted it himself, but we don't know yet. We haven't heard anything on that, apart from that he's being regularly tested. Although President Putin hasn't been seen in public since last Friday, he did give an update via video link to regional governors yesterday, where he told people to take these new measures that have been implemented in Moscow and in other cities very seriously, because Moscow is now under lockdown, a very strict lockdown. People are only allowed to leave their homes for a handful of reasons, and those include seeking medical assistance, going to get groceries at their nearest supermarket, taking the dog for a very short walk near their house, or taking out the garbage. People aren't being given allowances for daily exercise outdoors like they have been in other cities like London and Paris. And while those measures were introduced only in Moscow at first by the mayor of Moscow, they are now being seen more widely around the country as well.
Julia, we've also heard about certain people in the Russian administration who could be positive cases, but what is the clarity on that front?
Well, the Kremlin says that the person in the presidential administration who tested positive for coronavirus has not been in contact with President Putin, but it's difficult to see how he may have avoided infecting other people around him. So that's certainly something that the Kremlin will be keeping an eye on. And this, of course, is all as the numbers in Russia are climbing. They are now over 2,000. And that's as the testing process in Russia has become streamlined, because the numbers initially in the early weeks of the outbreak compared to many countries were very low. And there was certainly questions raised over Russia's testing process because all of the tests were being sent for double verification to a lab in Siberia, in Novosibirsk. That's no longer happening. Tests are being considered confirmed on their first results wherever they have been taken, and that's seen the numbers certainly rising in Russia. But the government has taken a number of measures. It's trying to keep that number as low as possible. It's still much lower than in a number of countries around the world. The government has now introduced these strict quarantines in certain parts of the country, and has also, the parliament yesterday has criminalized breaking that quarantine, which could be punishable by up to 5 years in prison. So there are certainly strict measures being taken now, and the government is very keen to keep those numbers low.
Right. Julia, as of now, nearly half of the regions of Russia, 40 out of the 85 regions in Russia, are under a lockdown. In that sense, we are yet to understand the veracity of the spread of COVID-19 in Russia.
Well, there are certainly some doubts spread over the numbers, but of course for many countries around the world, the testing is just not being carried out widely enough to really get a sense of the real picture. It's very likely that the number of coronavirus cases in Russia is much higher than the numbers that we're hearing. And that is because the people that are being tested are mostly ones that are showing severe symptoms and being taken in for medical treatment. A lot of people who are showing mild symptoms, who perhaps returned from Italy or elsewhere abroad in the last few weeks where the coronavirus outbreak was very severe, they are not necessarily being tested comprehensively, although the number of tests are being increased. We spoke to a laboratory last week that is trying to develop a home test so that anybody can go to their local pharmacy and pick up a test for very little money and take it home to test whether they have coronavirus. So when that does come into circulation, which is still a couple of months away, the numbers are expected to go up, of course. But in the meantime, the government is certainly ramping up testing. They have streamlined the process, and they are trying to get a better picture of the numbers, but it's certainly very likely that the numbers are a lot higher than we understand them to be right now.
Julia Chapman joining us with that live ground report straight from Moscow. Thank you, Julia, for being with us here on the broadcast.